So we are going to spend about, 45, 50 minutes or so talking about medical confounders. Basically looking at some of those things that kind of interfere with our ability to understand exactly what it is that we're seeing, or those things that we should maybe perhaps have in the back of our mind when a client comes in with a particular behavioral complaint or a concern. And so what I'm going to be presenting to you this morning is basically my perspective on some of the more common patterns that may show up. I am a firm believer that, not obviously every behavioral concern that comes through your door has an underlying medical cause. Of course not. Many of them are primary behavioral patterns. But that's not an assumption. And just because we're seeing or recognizing or reporting a behavior change, that doesn't mean that this is in fact a primary behavior problem. I'm also going to, as we go through all of this, emphasizing some of those places where, that whole, have your dog or have your cat vet checked. Where does that really come into play? And so what I'm going to give you is sort of my perspective on all of these things. So what we're going to cover is, over the course of this time here, is we're going to look at some different patterns. And again, I'm trying to look at this from the standpoint of what would a client perhaps mention to you, and how might we cluster those into different groupings to then be thinking about this a bit more, I guess the way I do it, clinically. So looking at clients reporting changes in activity, changes in appetite, perhaps house soiling or elimination pattern changes, aggression certainly, travel or transport issues, and then the category of episodic or kind of unexpected behaviors, just those things where the clients are confused about what they're seeing or why. So those are the things that we're going to get through. Again, not an all-inclusive list, but a great place to start, and you'll get kind of an insight into how I approach some of these cases. So first things first, if we're talking about changes in activity, again, from the client perspective, changes in activity, what are some of the things that they might be reporting? Now this may include things like, actual overt signs of limping or lameness, or it may be more activity specific, depending on what the activity is that the client or the pet owner is looking for their animal to perform. So in some cases, if we're talking more performance sports, for example, it might be a dog that's reluctant to jump or go through weave poles, for example, if a certain activity is perhaps uncomfortable. We'll talk about differentials here in just a second. Clients might report some of these other things as well, where the animal may be worse after rest or worse after exercise. Those lead us in different directions. They may have an altered mental state. They may be also reporting weight gain. Oh, he's not as active and he's gaining weight. Maybe the animal is losing weight, and they're also reporting an overall behavior change in terms of agitation or anxiety levels. These are all different clusters that may fall into this change in activity. And just so you know, for any of these categories where I'm saying a change, know that could go increase or decrease, right? It's just a difference from baseline. It's not always, and that's something we have to remind ourselves of, that it could go in either direction. Now, if we're talking about behavioral reasons why we may have a change in activity, these are some of the ones that I came up with when I was thinking about different patterns. And certainly we may see fear or anxiety. Have you guys ever had, let's say a dog who's showing a sign, showing perhaps significant, more generalized anxiety or more of an overall nervousness, and that animal essentially shuts down, and so they're much less active? That may happen. Have you ever had those animals where they actually go in the opposite direction, where when they're nervous, the activity level starts to spiral upwards? So always understanding that fear or anxiety could be underlying that. We may see a decrease in particular of activity, potentially as more of a fallout of training methods. So if we're talking, or that may actually be factoring right back into fear and anxiety as well, depending on the training method that's being used. We may see inappropriate reinforcement, and what I'm referring to there is perhaps the client who is accidentally responding to high arousal behaviors and is inadvertently reinforcing those behaviors. So what looks like hyperactivity to the client is actually positively reinforced behavior. So that needs to be on our differential list as well. And then certainly the underlying causes of overall reactivity, more of as an emotional problem, and then certainly the insufficient exercise. So all of these things may show up as a difference in activity. So if you're approaching a case that's coming in that's new to you, or the client is reporting a brand new concern, these are some of the things that we absolutely can and should be looking for as our kind of first line if we're coming at this from the behavioral perspective. with that being said, are there potential reasons why we might see medical issues here as well? And so again, thinking about changes in activity, just for that reorientation, if an animal is experiencing significant musculoskeletal issues, typically we're talking about pain or discomfort that may come from age-related or perhaps even trauma-induced osteoarthritis. So just because an animal is 2 doesn't mean that arthritis can't be there. Arthritis just means inflammation within the joint. That can be there for a variety of reasons. And so that should be on our list. Certain patients, especially if we're seeing more focal issues, especially with more obvious growths or tumors or things like that, can show up here as well. And then more soft tissue injuries, cranial cruciate ligament tears or patella luxations may impact that animal's overall comfort that may manifest themselves as a change in activity. So big cluster musculoskeletal causes. And these are not always evident. So let's say, for example, we've got a dog that has bilateral, so both-sided osteoarthritis or joint inflammation. Is that, let's say we're talking about that animal, maybe it's the hips, and that animal is equally affected on both sides. Is that dog going to have an obvious limp? No, they're symmetrical, right? So we tend to think, oh, well, if he's not limping, he's not in pain. And that's not necessarily going to be the case. So we've got to be looking at all of these different patterns. Now, we may see neurologic causes as well that may be anywhere from intervertebral disc disease, which is certainly more likely to affect certain breeds or certain shapes of dogs. We could have trauma. We could have degenerative myelopathy, which is a condition that's more specific to our shepherds and a few other breeds, but definitely in that direction. And we could have more, again, tumors or cancers. You're going to see that showing up in a lot of different lists as we go through this morning. And then lastly, more of the metabolic causes. And these are some of the things that just by looking at a physical exam, we're not necessarily going to be able to diagnose. So even a really, really skilled vet who does a really thorough physical exam is not necessarily going to know what that animal's liver function is, for example. They're not going to know whether or not this animal is concentrating their urine appropriately, or whether they're starting to see an elevation in blood glucose that may be indicative of underlying diabetes. Things like that, where just a physical exam is not enough to be able to rule in or out some of these other patterns, especially when we're looking at the metabolic causes. Now, kind of a special subset on the metabolic side of things would be more of the hormonal things. Or again, are we going to be able to diagnose an animal with hypothyroidism based on physical exam? No, we've got to get our lab work. So, when we have those animals that we send off to the veterinarian, we say, have your dog vet checked, and the client comes back and says, he did an exam, he said, do you want to do blood work? And I said, no, that's fine, I declined. Gah! Right? Physical exam's a great place to start, don't get me wrong, but there's just a huge amount of information that we are missing if we're not pushing forward to get the rest of that. Now, hypothyroidism is certainly one that we think about the most often for dogs. We know that dogs tend to go low, cats tend to go high, so depending on your particular species, you're going to have a different frame of reference on that. We know that in some cases we may see changes in behavior, changes in activity secondary to spaying or neutering. That's not to say that those are the only changes that we might see, and in fact, as time goes on, we're learning a lot more about what are some of the behavioral changes that may be expected from spay or neuter. And then these last two, Cushing's or Addison's, are really more related to the overall steroid hormone balance within the body. A lot more complicated than what I can really get into today, but on the Cushing's side, where we're seeing more of an overproduction of cortisol, and an Addison's side, basically seeing an insufficient body response in terms of stress, both in cortisol as well as some of the other mineralocorticoids. Anyways, so we've got those two issues that may show up in a variety of different ways. And again, these are things that we can't diagnose based on physical exam alone. So all of those things are going to be on our list for activity changes. So if a client is talking about any increases or decreases, yes, behavior, and these are some of the other things that we may want to consider. Any questions about sort of the overall format of how we're going to run through these different presenting signs? That makes sense? So we're going to look at sort of what they look like, what the behavioral, I'm going to call them differentials because that's kind of the medical way that I think about them. What are the differentials that we look at there, and then what are the medical underlying causes? So let's move on to changes in appetite as our second thing that a client may report. And again, change, so it could be increase, it could be decrease. This might be something that is correlated to another event that the client describes. So it's a change in appetite after we made a food change, or after he got into the trash, for example. It's sort of what I'm talking about with this dietary indiscretion. They may say, oh, he's not eating as well, and some of these other patterns, like, and the stool smells a little bit different than it used to, or the stool quality has changed as well. It's drier, it's looser. You know, I noticed a little bit of blood in the stool, or so on. So there may be other correlated changes that the clients are reporting that may help us to kind of narrow in one particular pattern versus another. It may be something that is very persistent, and you'll get a client that, you know, says something like, oh, he seems hungry all of the time. Just as a little sidebar, and we'll talk about this, I don't know, I think it's Sunday, when we're talking about getting history information. I'm going to give you a couple little tips along the way too. Anytime a client says all the time or everywhere or any of those sort of all or none statements, pause. Is it really all the time? Like even while he's sleeping, he's really, really hungry? Well, no, I mean not all the time. Well, okay then. So when is he hungry or when is he not hungry? What do we need to know? So that can help us out there. Are they actually hungry for food items, or are they eating non-food items as well? Or is it going in the other direction where we're having a dog that's kind of pickier about what they're taking in, or perhaps they're leaving food in the bowl? So all of these things may be indicative of the client reports of changed appetite. Now, if we're thinking about behavioral causes for decreases or increases in appetite, that certainly could be very simple. Maybe the client changed food and the dog or the cat just doesn't like it very much. This doesn't automatically mean that there's a big underlying behavioral pattern. It could just be true preference. The dog's like, meh, I'll get through it later. You know, low value food, right? So the intake's gonna be lower. We may have an owner reinforcement pattern. Food is love, right? So we may have dogs who appear hungry because that's sort of the behavior that's been reinforced, or we could have a dog that is becoming pickier and pickier and pickier because holding out for food yields higher value food items, right? So we can operantly reinforce each of those patterns in either direction. We may have an opportunistic behavior where maybe the dog isn't really as hungry as the owner thinks they are, but they've figured out, gosh, as soon as everybody leaves me alone, I have the opportunity to get into the trash, and I figured out how to knock that trash bin over finally. And so now I can get at all of those things I've been smelling for the last 3 years, for example. So is this just an opportunity-based behavior that isn't perhaps as indicative of other problems or not? And certainly breed-related patterns are certain breeds that are more likely to have high or lower appetites. And then the impact of fear and anxiety and appetite, typically in more of a suppressive direction, where we tend to see an animal with a lowered or decreased appetite when fear or anxiety is relevant for them. But again, that's not always the case. If we go a little bit beyond that behavioral side of things and say, well, what medical causes? Certainly, those that are specific to the GI tract may impact the way that that animal is engaging in appetitive or consuming behaviors. So that could be any of these cluster, malabsorption, maldigestion, malnutrition, which are different patterns that we see. They truly could be hungry. Maybe the owner is underfeeding. Maybe they ask somebody, how much does your dog eat? Oh, he only eats a cup? Awesome, I'll feed my dog that. And meanwhile, the dog is essentially starving. There may be a good reason why this animal is hungry, and so we're looking at that more as kind of a medical husbandry pattern. Or there may be other issues that are creating underlying discomfort, nausea, pain, or we may have more hypersensitivities. And even when I'm looking at GI causes, we're considering dental issues as well, whether that's fractured teeth, whether that is something that's more associated with just overall dental disease and gum sensitivity, gingival issues, or whether we're actually looking even at the musculoskeletal side of dental disease, TMJ issues, and an animal where it's actually difficult or painful to chew. Teeth may be fine, but it may be more of a mechanical issue. So basically anywhere along that GI tract that causes pain, discomfort, or anything along those lines could potentially impact the appetitive behaviors. Those are going to cluster a lot down here, so not only on the dental side, but any other sources of pain may impact overall appetite and animal comfort, and certainly the hormonal side. You're going to see some of these clusters appearing over and over again. because they can impact behavior in a lot of different ways. So in this case, if we're talking about thyroid issues, let's talk dogs for a second. A dog that is more likely to be hypothyroid, does that tend to increase or decrease the appetite if there's going to be an effect at all? Tends to decrease if we see a change. Oftentimes the appetite itself isn't all that different, but the animal is gaining weight on the same amount of food that they were previously eating. So it's not always an appetite change, but it's a relative difference in terms of that metabolic rate. However, if we're talking about the hyperthyroid cat, or perhaps the oversupplemented hypothyroid dog, where we're now bumping those levels up, appetite tends to go up, and we may have weight loss despite increased consumption of food as well. Cushing's typically increases the overall appetite. Addison's tends to be more of a waxing and waning, which is something that you'll see anytime we talk about Addison's. It can look a lot of different ways. It's kind of the great pretender in terms of the way that it can show up for our patients. But one of the things that's perhaps more common is to have more of an episodic kind of waxing and waning, good days, bad days, sort of a response. Anytime I get that sort of a history, this is always in the back of my mind is, maybe we've got something along those lines going on. So switching gears over to house soiling. You guys ever have clients who are concerned about their animals eliminating indoors? No? Okay, awesome. So we're going to skip right on through this. Oh, sorry. You're going to boo me right off the stage. Okay, so house soiling, what are some of the things that clients may report? So maybe a frequency observation where they're going, again, all the time. Probably not. If they are in fact going all the time, that's probably not an increased frequency. That's probably more of an incontinence issue, which we'll get to in just a second. So it might be an urgency. It's like when they need to go, they really need to go and they can't get to the right place. They may report changes in terms of the concentration. So when they go to clean it up, it's like water, so very dilute. And then all of these other changes there as well. Now this may be more on the GI tract side, it may be more on the urinary tract side, or both. And that's actually a really important distinction in that if we are seeing individual patterns, an animal that's having both urinary and GI tract signs either has a pretty big deal something going on from the medical side, or it's something that is directly impacting both of those patterns. Meaning if the animal has GI issues only, that shouldn't affect their peeing, right? So we can look at, is it one, is it the other, is it both? And that's going to help us differentiate some of these other patterns. And again, the last few on here, these are things that are going to be tipping us perhaps more in the direction of medical incontinence, which we'll get to. Now, house soiling for behavioral causes. Again, bread and butter, right? I mean, we're talking about clients all the time, talking to clients about this all the time, whether we're talking on the puppy prevention side, puppy intervention side, or whether these are issues that are new at any point in the animal's life. These could be things, especially anywhere from that incomplete house training. Perhaps it's clients who don't understand the rules of what house training actually looks like. I would say cold or wet climates. So I used to live in Minnesota, I'm now in Portland, so I went from cold to wet. Either way, we have our winter issues, where somewhere around November or so, the dog either decides that it's too cold or too wet, and I'd rather just pee in the back bedroom or in the basement. So we can see seasonal changes where we get more of a breakdown in house training based on the animal's behavior. We can see lots of issues due to anxiety problems, which are something where we look at the house soiling, it's really more of a secondary sign. It's not a primary elimination issue. There's a primary behavioral concern that is showing up as elimination. And in other cases, again, thinking on the behavior side of things, it may be lack of access. So the client who doesn't understand that this is an animal that perhaps actually needs to eliminate more frequently than they're giving them access to. So these are all of these different things that we are troubleshooting in addition to the urine marking option that was listed first. And then depending on the pattern that we're seeing, again, if it is exclusive to the urinary tract sign, then our medical mind is going to go over in that direction. And so again, I'm going to stress this over and over again. If that animal is having accidents in the house, and we send that animal, back to their vet, definitely get the vet check. Do we have control over whether or not the client chooses to run those diagnostic tests that are recommended when they get there? No, it's out of our control, I mean, I don't have any more control over what the client allows me to do than you guys do. I think that there are little communication things that we can do to not only help get that information, but also to help kind of prime the pump so that they're ready for that. That if we're saying, perhaps, make sure your dog is checked out by the veterinarian, or make sure that the cat is checked out by the veterinarian to evaluate for the possibility of underlying medical issues. I personally think it's entirely appropriate for you to say something along the lines of, they're gonna start with a physical exam. That's gonna be a big part of it. They may also recommend some specific tests that are gonna help them figure out whether certain things are a concern or not. I highly encourage you to consider doing those. Even just planting that seed to let them know that it's not just gonna be the exam charge. When they get there may be some additional costs associated with it. That's very different from saying, I need you to go to the vet and they're gonna run a urinalysis and x-rays and a culture. That's not for you or even for me to tell them what they're going to do. That's sort of the attending veterinarian's responsibility. But it's fine to kind of plant that seed that this is something that's probably going to happen, and there's going to need to be a discussion around these different options to try to figure out, are we dealing with something that is more specific to the urinary tract condition, the urinary tract health, or is it something that's more on the GI side? And again, basic blood work, if we're talking about a complete blood count, chemistry profile, thyroid screening test, urinalysis, that's a great starting point, but that's not going to say, oh gosh, all of those things were normal, therefore it's not a medical concern. We may have to look at more specific tests in either case. Now, the incontinence patterns, this isn't necessarily something that we can definitively test for in that classic sense. Again, we can't run a blood test and diagnose the animal with incontinence. It's going to be something that's more dictated by the patterns of behavior. And that's, again, something that you can do if you're working with that client ahead of time, helping them to understand what are the important details. So if you're recommending that they go back into their veterinary clinic, it may even be helpful to sit down with them at the end point of a session and say, and these are the things that we've noticed already that are super relevant. This is a dog that's eliminating on its bedding. You've noticed 4 episodes of soiling in the last 7 days. You've not noticed any particular blood or odor changes. Helping the client to actually get that information together so they don't walk into the vet clinic and say, my dog peed. Why? Right? Garbage in, garbage out as far as the information is concerned. That vet needs to know that information, and you're in a tremendously valuable position to be able to help the client understand what is the information that they need to relay when they get there. So please help out the entire team in that regard. And then lastly, if we're talking about house soiling, certainly some of the neurologic conditions may be here. And when we're getting kind of episodic issues where the client says, gosh, once every 6 weeks, there's urine or stool, and it's kind of messy, if you will, versus having a nice discrete little urine or stool incident. Maybe it's a seizure. Does the client actually know what's happening? And this is a good point when we're talking especially about house soiling, as well as some of these other patterns that may be what I would consider separation-related problems. Not saying separation anxiety. I'm talking about behaviors or patterns that occur when the animal is separated from the owner. And if the owner is just reporting, is only able to report what they see when they get home, we're missing tremendous, tremendous data. So, just saying, oh, I find urine when I come home, that doesn't allow me to say, was that animal sleeping and therefore was leaking urine? Was there a seizure episode? Was this a dog that was urine marking, in response to the sound of the FedEx guy at the door? All we know is there's urine on the floor. So in cases like this, if we're ever dealing with a behavior that's happening and it's not observed, the client absolutely has to get video. Has to. It's not optional. Anything we're trying to do without that information is purely speculative. It really, really is. And then again, lastly, sort of on the overall medical side of things, there's a whole cluster of metabolic patterns, again, that we are not going to be able to diagnose based on blood work, or based on exam only. These are different patterns that may affect not only the urine concentrating ability, but many other aspects as well. And we should be able to pick these up on routine labs and or some specialty testing. So we're going to have to look at all of these different issues. So let's toss a little case in for the kiddies here, just to kind of bring some of this home. So Domino, at the point of assessment, he was called in, or he was presented for urinating and defecating out of the box. So what do we want to know? So at the time of initial assessment, Domino was approximately 14. The issues of eliminating outside of the box had been increasing over time. Getting additional information about the household, and there is a medium-sized dog in the home. Domino is the only cat involved. And overall, the history is unremarkable. So the cat is eliminating appropriately, meaning 4 to 6 times a day on average. 2 to 5, 4 to 6, anywhere in there is pretty reasonable. In asking the client, is there anything about this animal's stool that's abnormal? Keep in mind that if you're asking the client to make a normal versus abnormal distinction, how many clients truly know what normal is? Right? It's normal for this cat to have really smelly, bloody stools, so that's normal, right? But for the whole population, not normal, not normal, not normal. And so, really asking them, do you see, and then giving them specific things can be super helpful. And then in that cat's medical record, they had done a urinalysis and a fecal in the history, and there was no abnormalities noted. So we're saying, okay, that's where we're starting out with. So we're going to try to get some additional information from Domino. The veterinarian had said, we'll add some, try some different litter options to see if we can get that cat into the box. There's a single box that's provided. Even though I'm saying the medical history was unremarkable, I'm also adding the caveat that it was relatively scant as well. The most recent exam was a year or so ago. It was basically a fecal and exam within normal limits. So I don't really have a lot of detail to go on to give me a lot of additional information. And the client had already declined an additional medical workup for whatever reason. So when I was out for the house call for this case with Domino, I saw this cat moving around in the space and noted that when the cat went to get up on the couch, for example, it kind of would put the front feet up and kind of give a little bit of a hop and a pull at the same time versus that real nimble jumping up for the cat. And so, asking the client, is this new? And it's funny when and I'm sure you guys have always experienced this as well, is you ask the client a question that you think is probably obvious, and they kind of look at you and go, huh. Now that you mention it, yeah. So that was when does he always need some help to get up onto the couch or onto the bed? Actually, no, he doesn't sleep with me anymore. He can't get up onto the bed anymore. And I help him up onto these other areas. Oh, okay, well that's really good to know. And that's especially good to know because you've got his litter box on an elevated table in your laundry room because you have a small dog in the household, and that's the solution that you've used for 14 years and you never gave it a second thought because that's what you've always done. So are there any changes to the household? No. No, it's exactly the same it's always been. So why is Domino being such a about this? And so then we've got these mobility issues that are there. So in thinking about the overall list of reasons why Domino might be eliminating outside of the box, obviously there's a laundry list of different things. And what we come down to here is that in most cases, or in this particular case, the most likely reason is because of mobility and access issue, we're having a cat that is toileting elsewhere other than the litter box simply because of lack of access. So is this really a medical issue? Well, yes. Is it a behavior issue? Yes. It's one of those combination cases, and we're going to be able to get to a solution with a combination. This cat probably needs some pain medication or additional medical support, and we're going to have to figure out how to give that cat access to a litter box. The easy thing was this was a large enough dog that we were able to put up a baby gate across the laundry room door and leave about 8 inches underneath. So the cat could now just go underneath, which allowed us to put the litter box down on the floor. Super easy management solution, and get the cat back in for a medical workup. And again, not optional now. This cat needs some help. So that's one case for Domino to see where this kind of comes together. Now let's talk aggression for just a real brief moment. And I say brief moment because if we really start talking about aggression, we're going to be talking about this forever, right? Lots and lots of details here. But what do clients report? It may be very specific, where the animal reacts aggressively to a very specific provocation. It may be associated with handling or physical contact or social contact or approach. They may also report other changes in the animal's activity level or energy level or their ability to move around or perhaps in their appetite. It may be described as unprovoked. In your history, how often is unprovoked truly unprovoked? right? Like, never. What I will often do when I'm talking with clients there, and whenever I hear that unprovoked word, I'll say, well, let's hold on just a second. When you use that word, what do you mean? You know, what does that word mean to you? And trying to get that. Because when I hear unprovoked, what I'm thinking is it was not intentionally provoked, which is different from it being truly unprovoked, right? And the clients, that's usually what they mean, is that nobody, you know, the dog reacted to the gentleman walking up and trying to give it food. Well, was that provoked? Absolutely, but it wasn't intentional. And so their perception of what that really means is going to be biased in that particular way in most cases. And then I would say the vast majority of the cases that I deal with is something along these lines, where the clients are, even if they're not able to nail it down 100%, they're able to say, oh, you know, she bites when, he growls if, you know, he doesn't like it when we, you know, so there's some sort of stimulus-dependent context that allows us to kind of narrow in on what we think may be going on. So if we're looking at the behavioral reasons why aggression may be occurring, not only understanding that it could be completely, totally normal and appropriate, but we have all of those different patterns that we may see. And I put this last one on there, saying just any other functional pattern, knowing that aggression as a big, broad word, I use to mean any sort of threatening or harmful behavior directed towards another individual. That could be extremely functional, either as defense or in an offensive manner. So not all of our patterns are going to fit very neatly into some of these other different categories, but we may absolutely see them. So what are we thinking about from a medical side of things? Now, keeping in mind that these patterns may be different if we're seeing an acute, sudden onset of behavior change, which we'll talk about in just a second, or whether we're seeing something that's been more progressive over time, or whether we're seeing something that is onset at a very young age versus a very old age, or if there's any other concurrent medical changes going on. That may very much shift our mindset in different areas. But certainly for a new onset issue, if there's anything going on, if that animal has an ear infection, for example, and the animals become very defensive around handling or petting or being greeted by strangers, for example, if there are certain body parts where the animal is resistant to touch or palpation or petting or massage, that may be an indication of an underlying pain issue. And other things like, let's say, pancreatitis or abdominal pain, it may be an animal that's just overall edgy, and it's not going to be real specific in one particular body part or another, but the animal just is maybe perhaps just overall defensive. Because abdominal or visceral pain, if you've ever had that yourself, you know, yes, it hurts here, but your whole body's a bit affected. So it can look a lot of different ways depending on where the source of pain or discomfort can be. And that's one of the challenges that we have for dogs or cats in the veterinary clinic, is that it can be very difficult to accurately localize exactly where that pain is coming from, especially if that animal is either highly stressed in the veterinary clinic and they may be masking, or maybe the veterinary clinic is one of their most important, favorite places to be, and so they rally, right? And so we're not seeing those overt signs. So it can be very difficult in some cases if it's not obvious, like again, let's say an ear infection or something that we can see externally. We may see aggression that is hormonally influenced, and I'm kind of putting a bunch of clusters in here as well. Again, anything that affects those steroid systems, anything that affects the reproductive hormones, and then thyroid dysfunction. Do we see animals who develop aggression or present for aggression issues because of changes in thyroid status? Absolutely. Does that mean that every dog who's aggressive has thyroid dysfunction? No. It is by far and away a minority of the population. And at least in the cases that have come through my door, I don't look at things like hypothyroidism and saying, I think that this is the cause of the dog's aggression. I don't think this is where this is coming from. What I tend to see in my population when I have a dog that has developed hypothyroidism or is sort of on the cusp of that, and it's perhaps a lower value than it should be, is that I find that it's almost that it presents more as an irritability issue. So it tends to magnify whatever predisposing factors that animal already had. So it kind of turns the dial up on that. So this is a dog that maybe didn't love being handled in certain contexts and now is reacting more aggressively. So it's almost more that it affects their threshold at which behavior change occurs, more so than saying this is a dog who's always been sweet and happy and all of these things and now we have a problem. That's not typically what I see with my low thyroid values. So any of these things may be there. And for me, irritability is a major, major factor for aggression. And again, it's not that the irritability causes the animal to be aggressive, it's that it affects the threshold at which that behavior may occur for that particular animal. And so if we're looking at sources of irritability or agitation, that could be anywhere from physical discomfort, harassment, or sleep deprivation. You know, if you're used to kind of sleeping the whole day away and now this thing showed up, and now nobody's sleeping, so everybody's irritable and everything that goes along with that. I'll often ask my clients, is there anything that you've done from a medication side that may have affected this animal? And medication for me is a broad category that when I think about medication, I'm not only thinking about pharmaceuticals, but I'm thinking supplements and herbs and food additives and the food itself, truthfully, the way that it can impact behavior. So all of these different things may show up from an aggression standpoint. Let's look at another case here. This is a cat named Moxie that presented to the behavior clinic for a concern of being aggressive to the owners and the visitors. So if this is Moxie in the veterinary clinic, are we going to be able to evaluate Moxie in terms of normal behavior? Are we going to be able to do a gait analysis and be able to see, how comfortable is Moxie moving around the room, and what does Moxie do when she's playing, and is she eating normally? No, you get a cat in a sink. That's what that looks like, and we can talk all day about how we might want to change this experience to be more pet-friendly and fear-free and all of those sorts of things, but that's not really my point here. My point is, if I see this cat in the veterinary clinic, I am going to be missing a tremendous amount of data that in this case became extremely clinically relevant. So for Moxie, about 6 to 7 years when I initially evaluated her, this aggression issue had been occurring for several years, so it wasn't a brand new pattern. It was getting worse though, and the thing that really tipped them off was that she was getting harder and harder to evaluate. So it kind of went from being really resistant to handling in the clinic to being, really highly stressed on the way there to being difficult to get into the carrier, and we're kind of backing into a point where now the client's like, I don't really know what I should do anymore. And for me, that's a big question that we ask for a lot of our clients is, if this is a problem that the animal is 6 or 7 years old and it's been going on for several years, why now? Why are you coming in and seeking help now? And I think it's very easy for that to come across in a judgmental way, like, why now, right? Why would you wait years to start evaluating this? And so the client might hear that, especially if they're already feeling a little bit guilty about the fact that this may have been going on, and maybe they should have sought help earlier. So I think it's really important when we're asking questions like this that could be taken in a more judgmental way by the client to really phrase how we're asking them. I can see that this problem is going on for a while. Is there anything in particular that's happened more recently that raised your level of concern that caused you to call the clinic to schedule the appointment now? So really just asking, what happened? Tell me about what's going on, versus why has it taken you so long? Right? Completely different ways of asking for the same information. So in her case, it was this progressive difficulty of examining. And the owners are using words like she's really irritable, and she's cranky, and she's intolerant, but yet she wasn't always like this. They were able to recall back to a time frame where they were like, yeah, she used to be a really nice cat. Not so much anymore. So what do we do, right? So get some additional information. As long as we leave her alone, she's a really nice cat. We can kind of just look at her and walk on by. Oh, nice, Moxie, nice, right? Then she's fine. So she's not outwardly aggressive, but if we approach her more directly, we may trigger a reaction for her. She's less active overall. Oh, well, we know that. She's not a kitten anymore. True, but is a 6 or a 7-year-old cat a geriatric cat where we would expect to see them really declining in activity? No, but the client thought, she was like, oh, she's an adult, so therefore this decreased activity is appropriate. Not really. She still should be more active than she is, so my brain's starting to turn in those directions. This started around 3 or 4 years old for her. And I said, well, that's interesting. So she would have, she's 3 and 4 years old, she's already mature. The nice cats at 3 and 4 usually stay nice cats. If they're going to have a major problem, it often happens a bit earlier than that. So I wonder, is there anything that seems significant around that particular time? They said, yeah, it was something that we noticed. There was a period of time where she was hiding for a couple of weeks, and then that seemed like was a tipping point. And said, well, that's, did anything happen? Anything that you can think of? And so they're saying, well, no, no, no. And we were probably 45 minutes into this conversation. We were talking about fear-based aggression and all these different things. And it just so happens, again, being in the home, I see Moxie walking toward me. So she's walking, I'm basically looking, if you've ever seen a cat walking directly at you, can basically kind of go from their head to their tail, straight down their spine. And there was just ever so slight, just a little bit of a change in her gait on one of her rear legs. And I was like, whoa, 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 whoa. Has that always been there? And of course they had never seen it. It was really super subtle. The vet had never reported it, nor would they, because again, Moxie's in a sink, right? So you're never gonna see it. It's not their fault. Even if they put her on the floor, she's just gonna sit there, or she might sort of slink and scramble. They would never see that. And so I said, well, actually, what do we think's going on? And so for her, if we look at this same kind of cluster of different reasons why behavior change may occur, we said, you know what, I'm not sure what's going on with that hip, but humor me. I know it's not going to be a great experience for anybody, but let's get her sedated, let's get some labs, let's get some x-rays as well. And she had a fracture. 3 to 4 years old. It was healed, sort of. And so when we got that information, the clients were like, oh my God, I never thought about this, but remember we said that whole hiding episode? They had come home one day and they had like a large sort of armoire, probably like 9 feet tall, that had some stuff on top of it. And they said, and it was one of the places where she used to rest. And they said the one time we came home and the stuff that was on top of that had been knocked over. And then she hid, so we thought, well, maybe she just scared herself with the noise. No, she fell off and she broke her leg. She hid, and because she was a cat, she healed. And so this has been a progressive issue of progressive osteoarthritis ever since then, right? So we got her on some pain meds, and lo and behold, she was a much nicer cat after that. We still had to work on some of the behavior issues too, but we were able to get there much more closely once we addressed the underlying issues for her. So moving on, I think one or two other categories here we'll get through quickly before we get transitioned into the next section. So travel or transport issues, what are some of the things that we may see? Clients may report a variety of things. It may be true, vomiting. They may be producing food in the back seat of the car. They may be vocalizing. They may just have a difference in their overall affect. They may be a little bit more subdued or perhaps more on the hyperactive, whining side of things. They may be reluctant to load into the vehicle, and these things may be more progressive or they may be acute, depending on the underlying reasons. So from a behavior side, certainly if the animal had a negative experience, and one of my patients presented this way after being involved in a car accident, and so the dog was like, nope, not doing that again, just never get back in the car. Is it a matter of inappropriate equipment, especially if we get to some of the medical things in just a second, if it's difficult for the animal to maintain secure footing or they're sliding all over in the vehicle? Is this an animal that has a reactivity history, and so watching the world go by at 60 miles an hour is an overstimulating scenario, and so we're seeing more vehicle-specific issues? Are there other fear or anxiety problems as well? Or is this an animal that maybe on the puppy or younger side is just inexperienced and we need to be able to acclimate that animal a little bit more gradually to what that experience would look like? On the medical side of things, certainly if this animal has any significant GI issues, whether that is true inflammatory bowel issues or motion sickness or nausea, the beautiful thing now is that we have medications where we can give trial doses to try to rule this out. Much better than Dramamine, for example. Not that that's a bad starting point, but so many better options to be able to try. And if we find that this animal is significantly different in the car with that medication on board, then it allows us to sort of back our way into a diagnosis of saying, yeah, I think there's something primary going on with this animal's GI tract, at least as it relates to nausea. I see a lot of older dogs especially, but again, not thinking only for the older dogs, but where we see more arthritis issues, where it's difficult to maintain their footing, or if they're bouncing around in the vehicle, it creates a different level of discomfort where they may not be able to control themselves quite as well as they would as if they were walking on a more stable surface. So pain issues can show up in a variety of different ways and manifest as travel-related issues. And I say for me, in my history, either I'm looking at behavior, GI, or pain are probably the big issues that I see as it relates to that. So if we're thinking about all of these different strategies, what I want to wrap up with just real quick here is just a quick little conversation about kind of how we bring this up. And I alluded to this a little bit before, that we can help our clients gather some information that they can bring into the veterinary clinic to help this process go a little bit more smoothly. But I think about this in kind of 4 different ways. And this is, I know, is a big point of discussion for this organization in particular, where I think, I believe, I know, something along those lines, that this organization really takes the ethics of the organization very, very seriously. And that is one of the reasons why I'm a member and why I continue to be an advocate for IAABC. So what I want to talk about here is just real quickly, what are the different things that we can do to really facilitate these conversations in a productive way? First and foremost for me, no matter who or what we're talking to or about, professionalism is number one, something that we have to present ourselves in a professional manner if we want to be appreciated as the professionals that we are. So what does that mean? Are you going to be working with, let's say, dogs or cats, where you might perhaps have some reasons to be critical of the medical care that that animal is receiving? Or are you 100% in agreement with everything that happens for every single one of the animals that you've worked with, right? Yeah, I see a few smirks in the audience, right? And you're like, yeah, it's gonna happen, right? I see it too. I'm gonna say, oh, I would have done that differently, or gosh, I wish they would do this instead. So when you have that perception, depending on how you phrase that to the client, that can really either facilitate a new conversation, or it can create very, very awkward communication triangles. So if you talk to the client and say, wow, I can't believe that vet didn't run the full thyroid profile. That's weird. I totally would have done that differently. I think you should get a new vet. Right? Clients hear that from both sides of the equation. It's kind of go the same way from, gosh, I don't know why that trainer's using food so much. I think you should get a new trainer. Right? We can be critical on either side of the equation depending on what our understanding is of the other side. So what I'm trying to do when I'm talking with clients is not putting them in a difficult position. So if there's something that needs to happen, how can we facilitate that? Whether that means, directly reaching out to the veterinarian themselves, or whether it's giving the client, again, perhaps a bit more communication to say, wow, based on what we're seeing here in your house, using Moxie as an example, I could have been really critical of that veterinarian and say, I can't believe you missed this fracture. It's been there for 4 years. How could you have missed that on every single physical exam? I could have gone that route versus saying, I had the opportunity, because I was in the home, to see a different set of data than what you've been able to appreciate in the clinic. Here you go. Now what do you want to do? And so we have the ability to put that out there in a very professional way that's not going to be as likely to trigger a defensive reaction, again, either for the client or for the rest of the veterinary team. So we are all working in the same direction. I think we all need to respect the boundaries of our own training and credentials, and I say that all of us. There are certain things that I really don't have any business talking about. If I have a client who's coming in and they're really working on performance sports, for example, am I the one to really talk to them about how they should really, work on weave pulls? No. I don't have a clue how to train weave pulls. I think I know what I would do, but I've never actually done it. I have no business talking about that side of things. So I can say, well, here's what I know from sort of my perspective, and here's what I can do. Here's how I can complement what else is there. So, if I'm respecting those boundaries, and if I need to relay that information to someone else who's involved in that animal's care, I may ask, what's going to be the best way for me to get in contact with your trainer? What's going to be the best way for me to get in contact with the veterinarian? I might call their office and say, hey, I've got some things that I need to relay. Do you want me to fax that over? Do I have an email address? How do you want me to communicate that? Or is phone going to be the best option? It may be a matter of asking the trainer to come along to an appointment so that they're right, in the mix right from the get-go. But overall, it's trying to avoid that putting the client in that awkward position and maintaining that professional respect. Now, I know that's easier for me to say. I know that you, as an organization, trainers, behavior consultants, do not always get the level of professional respect from the veterinary community that you deserve. And I think that there are ways that we can facilitate that. So these are some of those communication things. So I think it's also relevant to be able to create a sense of advocacy for the client. If the client is not getting the level of veterinary care or training support, again, this goes in both directions, the client is the one who knows the animal the best, right? So if they need to be an advocate for that pet, whether we're talking about the veterinary care or the type of training that the animal is receiving, it's okay to do that. And we can kind of push them in certain directions if and when we need to, but ultimately, it's their decision. And we'll be talking a lot tomorrow morning about client compliance and looking at case examples of how we can really kind of affect that communication and how we can affect the entire process and get our clients on board with what we're trying to do. So we'll be talking a lot more about that tomorrow. And then lastly is just this understanding when we're talking about both behavior and training, or excuse me, behavior and medical, that these are two completely different but very much interconnected things. So if we have an animal who has, let's say, developed defensiveness around physical handling secondary to an ear infection, that doesn't mean that just because we clear the ear infection that changes that animal's learned response. Or that just because we've worked really hard on creating a positive conditioned emotional response to hands, that animal is never going to react that same way again if their ear starts to hurt again. So this is a moving target, and the balance between these things is very much something that we have to stay on top of, utilizing some of these different strategies. So with that, I'm going to wrap up for right now. We've got a variety of different patterns, and we'll talk more about these details, but this is where we are, and I'm going to turn things over to our next presenter. Do you have any last-minute questions for me? I can take one, maybe. If not, I'll be available at breaks. Awesome. Thank you, guys.